All right, you guys, so I'm going to make a video over a quick rundown over different infections for the skin. So let's start with bacterial infections. The first one's going to be cutaneous anthrax. The cause of that is Bacillus athletis, spores entering the skin through cuts or abrasions. Signs and symptoms, it's going to begin as a small itchy bump, which then forms a painless vesicle, which then forms like a black necrotic center called an eschar, and patient may have a mild fever at this point. The treatment would be oral or IV antibiotics, such as ciprofloxacin or doxycycline. And you also want to educate the patient on avoiding contaminated animals or products and monitor for systems of systemic infection, so like fever, chills. Next one is going to be folliculitis. So the cause of that is infection of hair follicles. It's usually caused by Staphylococcus aureus. Signs and symptoms, it's going to be a small red pus-filled bump around the hair follicle with mild itchiness or tenderness. Nursing interventions are going to include topical antibiotics like mupirocin, warm compresses, teach proper hygiene, and avoid shaving over the affected area. Next one are going to be furuncles, also known as boils. The cause of that is going to be a deep infection in the hair follicle, often caused by Staph aureus. Signs and symptoms include firm red painful nodule that may drain pus. Surrounding skin may also be swollen. Treatment for that is, if it's large enough, you can do an incision and drainage. Systemic antibiotics if it is severe, and you also want to teach hand hygiene and or daily wound cares. Next one is cellulitis. So that is infection of the dermis and subcutaneous tissue, often involving Staphylococcus or Streptococcus. Signs and symptoms are red, warm, swollen, tender skin. It spreads quickly and patient can develop fever and chills. So nursing interventions, you are going to use a Sharpie and draw a marker over where it is. And you want to see if it is spreading. You can also do oral or IV antibiotics depending on the severity. Elevate the affected limb. Monitor for sepsis. Monitor their white blood cell count especially. And assess for lymphangitis. Next one is MRSA, which is methicillin-resistant Staphylococcus aureus. So cause is antibiotic-resistant staph infection. It's going to look red, swollen, painful lesions, often with pus, and it may appear like a spider bite. Treatment/nursing interventions are you're going to do a wound culture to determine the antibiotics, proper wound cares, contact precautions, and also teach the patient about hygiene to prevent the spread. For viral infections, we're going to talk about herpes simplex, HSV1 or HSV2. So they are caused by the herpes simplex virus infecting the skin or mucosal membranes. Signs and symptoms are going to be painful vesicles or ulcers near the mouth if it's HSV1, or the genitals if it's HSV2. Or also a tingling or burning sensation before outbreak, and it can also be reoccurrent. So treatment/nursing interventions are going to be antivirals like acyclovir, pain relief, avoid direct contact during the outbreak, and teach about triggers and infection prevention. Usually it's triggered by stress as well. And if it's HSV2, you want to teach safe sex practices as well. Next one is going to be herpes zosters, also known as shingles. So the cause of that is a reactivation of the varicella zoster virus in the dorsal root ganglia in the spinal cord. Signs and symptoms are going to be painful, unilateral vesicular rash along the dermatome, itching, burning, or tingling, and it may also cause post-therapeutic neuralgia. So treatment is going to include antivirals like acyclovir or valacyclovir, analgesics. You want to keep the lesions clean. You want to teach about the vaccination to prevent shingles as well. So for fungal infections, first one is going to be tinea, also known as ringworm. The cause of that is the dermaphote fungi infecting the skin, hair, or the nails. The signs and symptoms are red, circular, scaly patches with a clear center, mild to moderate itching, can also appear on the scalp, body, or feet. Nursing interventions are going to include topical antifungals like clotrimazole, and you want to keep the area dry and avoid sharing towels or clothing. And then for candidiasis, the cause of that is overgrowth of candida, of the candida species, especially Candida albicans. Signs and symptoms, it's going to be red, moist, itchy rash. It's most common in areas where there are skin folds, so under the breast, under the abdomen, or in the groin area, or the mucous membranes. So it can also occur in your mouth. And it kind of looks like white patches. It kind of looks like white patches, which is also known as thrush. So nursing interventions are going to be topical or oral antifungals like nystatin or fluconazole. You want to keep the skin folds clean and dry, and you want to teach about personal hygiene and monitor for reoccurrence.